All right, since it's November 30th, I thought it was a good day to discuss some genetic stuff because it's the last day of the month where I get to celebrate that I am 5 years done with chemo for my ovarian cancer that was found 5 years ago, and for which, you should all know, I do not have any genetic marker, meaning I don't have a gene for ovarian cancer, but there are some buts here. So I want to just discuss genetics. And genetics about a bunch of things, not just cancer genetics, though that is kind of my focus, but with an underpinning of genetics in general, because genetics are very confusing for us as doctors and certainly for you as patients. So when you are born, you have your chromosomes from your mother and your chromosomes from your father, and typical people have 46 chromosomes, and their sex determined at birth would be 46XY or 46XX. That's for the majority of people. Some people have an alternate number of chromosomes and still have no abnormal features that anyone would know about. So that's just chromosomes in general. Chromosomes are essentially made up of genes, right? That we kind of use those terms interchangeably, but the word is genes, meaning the genetic predisposition, what you have inherited from the sperm and the egg that created you, okay? Now, when women choose to get pregnant, before they get pregnant or during the pregnancy, they are nowadays very standardly offered genetic testing. The standard genetics right now, the panel is pretty limited, but the opportunity is that you could take a bunch of different genetic panels, meaning the standard is about 2 or 3 genes that the American College of OBGYN expects us to do: cystic fibrosis and spinal muscular atrophy in particular, and something called Fragile X, which is slightly different. But those are the basic genetics that you will get offered and often just get done when you have your blood tests, if you're pregnant or if you're trying to get pregnant. But you can also choose to opt for bigger and bigger panels. There are panels that have about 27 different genes. They have panels that have 200 and something different genes. And the biggest panel, I believe, is over 500 different genes. Now, those genes that we look for are largely what we call recessive, meaning you would need to have 2 damaged genes in order for there to be a problem. Hence the reason that now in your adult state that you're choosing to have a baby, you probably don't have any of these medical conditions. And there are hundreds, most of which many doctors don't even know or have heard of because they represent entities that are rare. So again, recessive genes mean you have to carry 2 damaged genes in order for that physical trait or that disease to present itself. So you might very well be a healthy 51-year-old like me and carry 1 recessive gene that is abnormal for something. Let's say in my case, for example, because my last pregnancy was over 11 years ago, I didn't even get offered all these genes because many of them didn't exist. So there are many genes that I might currently carry and I just don't know about it. It would only matter if I carried it and if my husband carried it, and then 1/4 of all of our babies would be able to potentially have 2 damaged genes and have the expression of this gene. Let's say it were cystic fibrosis. If I carried a cystic fibrosis gene, he carried a gene, neither of us is affected, but 1 out of 4 times there would be the potential that the baby would inherit both defective genes. I bring this up because when you get offered either pre-pregnancy genetics or during your pregnancy you get offered genetics, many people are confused because they think that that means all of your genes, and it does not. It very specifically means these recessive genes for the purpose of knowing what will happen to your future pregnancy. The second genetic test you will be offered in pregnancy often is what we call the NIPS or NIPT or cell-free DNA. So it's non-invasive prenatal screen, non-invasive prenatal test, or cell-free DNA, which are all the same thing, which is a blood test that looks for little fragments of the baby's DNA. This is once you're already pregnant, and the fragments of those DNA that circulate through your body can be examined through a very challenging and interesting scientific basis, and they will be able to tell you what the chromosomes of that embryo are, whether or not they have the normal number, whether or not it is a sex assigned boy or a girl. And sometimes you can look for other things that are called microdeletions, meaning small little irregularities in the genetic code. It's not 100% accurate, but it's an excellent blood test that is not invasive. Much like the amnio, which we loved, which was more conclusive, the amniocentesis, but that is more likely to cause issues, even though it's very rare that with an amniocentesis you'll have any problem. But amniocentesis is an invasive test where the amniotic fluid gets sampled. The NIPT blood test, it doesn't have any harm, okay? So again, those are the 2 genetic tests you get offered in pregnancy. You get offered the genetic screening for carrier screening, we call it, for recessive genes, and you get offered the genetics of the actual baby. Neither of those is related to cancer genetics. So unrelated to pregnancy, you might, at a remote time from pregnancy, get offered cancer genetics. Now, occasionally in pregnancy, if you happen to be seeing a genetics counselor who has the time to discuss this, they may address family cancer genetics as well, but that's unlikely because it's a whole extra discussion that really requires a lot of information and understanding about what you would do with the information that you might receive. So unrelated to pregnancy, any man or woman might get offered genetic testing if they have a strong family history, and there is an entire list that the American Cancer Society has put out, strong family histories in particular of breast, ovarian, colon, uterine, melanoma, pancreatic, and prostate, among others. There are some others, but those are the more common ones. And the desire for genetic testing is increasing. The knowledge of genetic testing is increasing. The cost is decreasing. The availability is increasing. So it really offers an opportunity for we as individuals and we as physicians to be more proactive about any individual's health. Now, it's not without flaws. So first and foremost, I really believe you need to be counseled well on whether or not you would do anything with the information and whether or not what you would be offered to do will not make you really anxious. Because some patients unwittingly go in to get genetic testing, they get told they carry a gene, only to then think, I don't want to do any of these things that I'm being offered, and now I have to walk around with the knowledge that I have a gene and the things that are offered. For example, prophylactic surgery where you remove your breasts or your ovaries if you have one of the cancer genes that increases the risk of ovarian or breast cancer. That might be really unpalatable to many people, and therefore they're walking around with this knowledge without being able to necessarily proactively decrease the risk. Now, that's not exactly true because you can still do other screening tests and you can certainly change and adapt a different, healthier lifestyle that you might not have otherwise. But again, you can understand that it requires a deeper level of discussion. It's not kind of a just, let's just check it off and be done. So I think it's really important for you to know that A, there are different meanings when we say genetic testing. B, if you got testing during pregnancy for genetics for you or the baby, that did not mean cancer genetics most likely. C, every year you should revisit with your family whether or not any of your first degree or second degree relatives, that means children, siblings, parents, and then second degree relatives, which would be aunts and uncles, cousins, or grandparents, if any of them have any cancers. And then you can discuss it with your doctor as to whether or not it's valuable to go see a genetics counselor for blood test genetics. I, again, did not carry any gene 5 years ago, but I'm due to retest because what that could have meant is either there's a gene that was not yet discovered, or that there are multifactorial reasons that could still be genetic, or that there's no genetic component. So it doesn't mean that my children are at no risk because we don't exactly know why I got the ovarian cancer I got. If I did carry a gene, while many people would say that sounds so scary, I would say, actually, that offers me the opportunity to be even more proactive in a calm way. Okay, I hope that makes sense. Genetics are confusing, even to us.